Good morning, everyone, and good afternoon. This is Julia White, and I'm really excited to be able to start this webinar with you all today. So today we're going to be talking about Market Bookshelf, which is the market intelligence repository. And I have online with me Andrea Baer from WDI and Erica from WDI as well. And they're going to be controlling the slides, so I'll just tell them next slide as we go along. And we'll get started. So next slide, please. Great. So the agenda for today is that I'm going to do a little bit of an introduction and an overview. And we'll talk about some document types and sources. We'll talk about some technical features of the site. And then we're excited to do a live demo. And we'll have a wrap up, and then we'll do some questions, because really, one of the main things about this today is that we're really excited to be sharing it with the MDA working group to be able to do a kind of soft launch and get everyone's feedback on what they think about it, any suggestions or recommendations they have for the site and for sources as we go through. So as we go along, please feel free to write questions in the little text box. We'll see them as we go, and if they're quick and clarifying, we might just handle them as we go along. Otherwise, we'll gather them for the questions section at the end. Next slide, please. So we're going to go ahead and jump into the introduction and overview of marketbookshelf.com. Next. So the business case for better dissemination of market knowledge. What is that business case, and how can we sort of promote use of this market knowledge? So one way is first to kind of, if we consider the cost effectiveness and return on investment of calculations for public health interventions, we'll see things that a lot of you have probably seen before. For example, 2015 study from Health Affairs said that for every $1 spent on immunization, there was a $16 return on the cost of illnesses averted. Similar with rollback malaria, there was an estimated 40-to-1 global return on investment, even higher for sub-Saharan Africa, in malaria prevention and treatment. So the idea is that the business case for this type of market knowledge sharing is that we could apply a similar thinking to the generation of market information. So there is a kind of economic value of market information for both those who are trying to define markets and those who are trying to enter markets. And you can think of that a little bit in terms of avoiding duplication, as well as getting access to the type of information that would help to determine whether it's a risk or not a risk. And so there's a cost savings there if we avoid duplicating those same efforts over and over again. And there's also a cost savings if those who do decide to enter the market are able to use this information and make the right decisions and reduce their risk. So, you know, that's part of something. There is this economic value, and because of that, donors do make this public good investment in information to help inform investments and programming with the hope that it will have this economic value. As we know, it's kind of difficult to quantify this exact return on investment, especially when you're talking about research and analysis. But we know the amount of money spent, so there's an assumption that it's a public good, that that money is being spent by these donors because of the economic value that we were just talking about. And so really that leads to the last point, which is, does the current system sufficiently leverage this investment and result in public good? And you know, we were thinking and have heard from the community that there is a need for something to help better leverage that, and that's where Market Bookshelf comes in. Next slide, please. So marketbookshelf.com was born, as a lot of you will know, from within our very own MDA in the market intelligence work stream. And that also was coupled with a prior beta website that was developed by WDI that was focusing on market dynamics. So it was kind of a great case of matchmaking between the market intelligence work stream and work that was already underway. And so the tagline became Global Health Market Intelligence at a Click. And the idea is that it's a large and growing open access collection of health market literature, offering immediate access to these documents and resources that will help to understand, develop, and intervene in different global health markets. And as you can see at the bottom, there were 3 groups that kind of spun off from the initial market intelligence work stream to really focus on developing and launching this. And it was USAID with WDI and the Reproductive Health Supplies Coalition. Next, please. So it was developed with this group of market specialists really to respond to what the community had been talking about as an unmet need. The lack of a one easy to navigate place to facilitate the dissemination and sharing of global health market knowledge. So as you can see here, the purpose and intent, creation of this one-stop shop to recognize and leverage what we talked about before with the public good of market knowledge, and to offer an up-to-date, easily searchable and downloadable collection of documents. Next. So it is definitely a living resource. What we mean by that is the repository is always growing, and the team is always on the hunt for new articles, reports, and tools. So we're excited to say that right now it's up at almost 400. It's at 389 documents with over 400 authors. And they're being indexed, which would mean tagged for filtering purposes by the different areas you see there. So content, authors, organizations, health area, year, document type, and geographical region. And we will be going into those more in depth. This is just for the overview. Next, please. So the team has made considerable progress on the development and testing of the website. And we have a strategic plan for a hard launch in October. So what you see there on the left are the tasks that have been completed prior to June 2017. So we've done the full website development, in-depth searching to get to the documents we have now. All of the documents that we have right now have been uploaded and tagged, and we've done beta testing with members from the community, including from MDA. So here we are in June doing the soft launch with you, and then we're hoping that this will spark getting even more documents and more sources identified for the next couple of months. Then we'll do sort of a broader launch with the e-blast and different communication campaign. And then in October, at the membership meeting, we'll do the full launch. And throughout all of this, we'll have ongoing monthly uploads of document submission and site maintenance. Next, please. So as I mentioned, Market Bookshelf is a collaboration of 3 distinct organizations that have been a great collaboration because they bring different things to the table in terms of the design, implementation, and sustainability. So from USAID, there's a really helpful sort of knowledge about what the donor mandates are right now regarding dissemination of knowledge generation and where USAID and others are standing on that and the rollout of that. And then there's also their ability to leverage projects with multiple entities and aligned interests. And so we have been able to get some human resource through working with USAID to continue sort of the ongoing maintenance and monitoring. From Reproductive Health Supplies Coalition, it's our workstream structure and our ability to sort of do the matchmaking that led to this partnership within the market intelligence workstream. The broad reach, that's going to help with the dissemination and sort of the source, getting more sources and getting the word out there about the tool. And technical expertise, which we've applied, especially around the website development, thanks to our colleagues in the communications in the Secretariat, and also our involvement in markets and market development and that technical background. From WDI, there's really strong background in terms of already working to develop knowledge to improve the effectiveness of sort of the private sector and social welfare and their interest in looking for partnerships to share knowledge and resources, sort of been a mutually beneficial match in that sense. So this team has worked together to get to the point we are now and to establish kind of a 3-year terms of reference to define roles for maintenance, document identification and uploading, communication, and ongoing enhancement. Next. So this market bookshelf definitely provides relevant resources to a range of stakeholders. And so you can see some of the icons here to represent some of those. Your pharmaceutical or device manufacturers, again, who are going to be determining if they should enter a market and are interested in understanding market needs and conditions across a wide range of countries. So this will offer that type of information. If we move clockwise, going across to international development workers, this is really, you can find the work that your peers are doing, so you're not duplicating it, and also increase the visibility of the work you're doing to enhance partnership building, avoid duplication, enhance the work that you're doing and the outputs of that work. For public health practitioners, this is really, it can help with research and providing a breadth and a depth of examples across global health. And for government officials, the thought is that as you're sort of doing different evaluations to figure out the best strategies for your countries, this can really inform the evaluations of the situation and strategy development. Next. So why use marketbookshelf.com? We think this is a really important question and sort of some of the what's in it for me and why should I use this versus something else. So definitely this marketbookshelf.com was created really to respond to the unmet need with a focus on global health and responding to what people had said they would like to see. You can see that it's easy by looking at the lower left-hand corner. There's no registration, so you can have immediate access and immediate download of whatever you are able to find in there. We are looking to get a breadth of documents from a wealth of sources, a multi-source, partially curated, so that it's not just a data dump and it's also not just such a small set of documents that it's not useful, but looking across market research, activities, analyses, and really trying to get at some of the stuff that's harder to get, especially gray literature that isn't already out there. And we've been trying to work with private sector to get some things on there that you'll hear about more when we get to the sources. But really, this is in part what differentiates it from doing a Google search, for example, is that it is partially curated, that it is really trying to focus in on this wealth of resources specific to the global health community and gray literature and things that you wouldn't find on Google. And that it's quick and tailored results. So it's really one of the benefits here is that the filters have been created so that, yes, you can do your free search, but that your filters are going to allow you to get to exactly what it is you need specific to the global health market community. So now I'm going to hand it over to Andrea, who's going to continue on with the next series of slides.
All right, great. Thank you, Julia. Good morning and good afternoon, everyone, and really appreciate you joining us for this soft launch, as Julia mentioned, and Erica and I from WDI are really delighted to be a part of this. And we are going to be very interested in people's feedback and additional ideas and recommendations for what to include, which is a great place to start and emphasize that as we start to talk about the document types and sources that are included in marketbookshelf.com. And I just want to say as we go into this, how great it has been working with Julia and Lucian from RHSC and Denise Harrison and a couple of colleagues from USAID. So our aim really is to think about a broad variety of global health market literature. And you'll see as we go through this, because we were thinking about this both from a standpoint of what to reach out and access for including, but also how to do the tagging in terms of actually designing the website and the search functions to make things easy to find. So recognizing, of course, that there's always a range of terminology in terms of how we all think about things, whether we're using the term total market approach or market shaping or market dynamics, that what is in common is that we in the global health community, and no matter whether we're focused in one particular market or geography than another, we are all ultimately thinking about getting the right product to the right people. And so we're thinking about supply and demand. And we ultimately organized our thinking in terms of documents to go through essentially the work order or process. So first, the idea of market analysis. So we have documents that analyze markets from these various supply and demand perspectives, and thinking in terms of the 5 A's from the market shaping primer developed by USAID along with multiple partners. So access, affordability, availability, etc. So in this type of document group, you'll find things that we all routinely think of in terms of market segmentation, landscape analyses, and so on. Then documents that we group as market interventions are much more about what I think of coming from the private sector in terms of like strategies and the way we approach markets, whether that is social marketing or whether it's a volume guarantee or pooled procurement, all those types of tools that the global actors may use to increase access to products. And then finally, we saw that there's definitely an entire group of documents and tools that really combine these two activities, that recognize that you always start with market analysis in order to design what your market interventions are. And that's where we will put things in here like total market approach and market shaping. Now, admittedly, we will say that these are broad categories, and to some extent, it's in the eye of the beholder. So this is an area that we will definitely accept feedback on, especially as authors may see how their own documents are categorized. This next page is really to just give you a brief example of that, of these different types of documents. So on the top left, you see what we've categorized as a market intervention. Then on the bottom left, a market analysis, and then over on the right, a cross-cutting document. And this page is simply to kind of show you the range of author, organization types, titles, and how they might be categorized. And you'll see more of this during the demo. So how we came to this 300 and some set of documents that we have so far, and even more authors, is the next good question of how we got there. And so on this page, we just wanted to share our source list to date in terms of what we've already searched, as well as identify other sources that are still under review. And I will mention here that what we have in the repository really is a focus on documents, reports, and tools. It is not raw data. We do recognize that raw data is often collected, and there's a lot of value in that, but we did not go down that path for this first focus of the website. This page really emphasizes the importance of the dynamic nature of our sourcing and what will be in the repository. We are going, overall, we're going for breadth and quantity. As Julia mentioned, we will do and are doing some partial curation, but not full curation, in that we, as the team working on this, are not attempting to make evaluative judgments about what should be included or not. So we are going to aim on the side of breadth and inclusiveness. There are, in the area of under review, you'll notice something like USAID's DDL. This is an example of where we and our colleague Denise Harrison recognizes that There are many documents potentially in the DDL, and we're working with, the intent is to work with USAID's data steward to see what we can pull directly from there. You'll also notice the reference to IMS, and this is really the recognition that we truly believe that the private sector and private sector data collection is an absolutely critical part of what we do. And that's where we want to engage with private sector colleagues for how to make this really a mutually beneficial environment where they can also share with us. And we do recognize the challenges and sensitivities around data sharing, but here is really where we would come back to the idea as introduced at the start, which is really thinking about the fact that we're all in this to work for the public good and improve the health outcomes in low resource and emerging areas of the world. And in this world of time of scarce resources, the more we can do to build on knowledge and not repeat knowledge generation, the better we're doing for everyone. This page really is starting to introduce the idea that, as we said, it's dynamic and living, and we're going to be looking for everyone's assistance and what to upload. When Erica shows you the demo, she'll touch on this, but basically what we have is a really simple form that will make it very easy for people to submit documents. And here we are hoping for documents that are less easy to find, as Julia mentioned. Now I want to spend just a couple of minutes on some of the technical features of marketbookshelf.com. And our colleague from the Secretariat, Lucian, is not on the phone today, but I want to emphasize that he has just been instrumental in helping us design this. So the first thing is to share with you a little bit about the search function, and you'll see more of this again in the demo. But essentially what this does is it indexes keywords in the document title, the abstract, and then uses a weighting of the search filters as well as the indexed content in order to produce the results. So basically conducts this free search, uses a scoring algorithm with the weighting that you can see on the slide to then basically provide the results and order those results in a way that it's ordered from highest score to lowest that would be most likely to deliver on the searcher's desired result. And then the third aspect of this is using the drop downs for more tailored results. And this will become more apparent in a minute. So the 7 filters we have are here on the right: health area, content area, I just introduced that, geography, document type, author, organization, and date. Here lists these 4 in more detail. Pretty intuitive, really. The geography structure uses the World Bank geography structure. We specifically did not code at the level of individual countries. And really that is because many of the documents are not country specific or they cover multiple countries. And you'll see there's a way with the combined search effort to actually combine the geography filter with your country of interest. You'll see the way we categorize the document types into 4 big buckets. The health areas is super intuitive. The only one I will call out is the one at the top, health area agnostic. And essentially, this gets at all the kinds of work that's been done that truly is not specific to a given disease state or wellness area. And that would be, for example, a private sector assessment in Senegal, where it's really looking at, and this is the kind of work, for example, that APT and others have done, that says, who are the private sector providers across the types of outlets and providers and various disease states that they serve. This next page gives you a little bit of the techno speak for those on the line who are perhaps highly technically oriented towards search engines. And so it's always fun to include a little bit of this, but essentially you can see that we've already been propagated to the search engines. Lucian has already optimized the web site so that we're getting good scoring in terms of speed and optimization. We've spent a fair amount of time with this tag optimization to drive the search engines and using kind of the newest technology in terms of displaying the results. And also, of course, page speed is important for everyone, and we feel that we've been able to optimize that relative to current standards. At this point, I am happy to turn it over to my colleague, Erica. She's just going to switch us over very quickly to the web so that she can actually show you the website. And just as a reminder, please go ahead and type in any questions that you have, that you had as we've been going through this or through the demo, and then we'll field questions at the end. Thanks. And Erica, want to take it away?
Thank you, Andrea. Hi, everyone. I'm so happy to have been a part of this project here. So let's dive right into the demo and explore the Market Bookshelf website a little bit. So to begin the demo, we're going to start on the Market Bookshelf homepage. Here we will see some of the information we've introduced earlier in this webinar. So directly below the search bar, we feature these short descriptions of the 3 content areas that we have used to group all of the market documents featured on the repository in order to guide the user in their search. These are the market analyses, market interventions, and cross-cutting. And below this, we feature the different health areas that the documents can be tagged under, and you'll notice that all of these categories are clickable to allow the user to easily find all documents tagged under their area of interest. So to help the new user see personal value in the site, we are prominently featuring the different use cases for different types of professionals. This Learn More button below will link you directly to the About page and the page a little later. We also provide a quick snapshot of the recently uploaded documents to help any user get a sense of the type of documents they are likely to find in the repository, as well as to prompt submission of new documents. A direct link to our submissions page is right next to this with a brief blurb advertising the new user-generated submissions. Now let's jump into the heart of Market Bookshelf and see how the search function works. So scrolling back up to the top of the page, we can start a free search for documents by typing a word or phrase into the type anything and hit search box. Note this is not a live search, so you do need to press the search button. Hitting the enter or the return key will not work. So let's say we were interested in finding all documents related to a total market approach. So our free search for total market approach currently returns around 200 documents. Whoops, I had a typo in there.
That was a planned typo.
It returns around 52 documents from the repository, but because we only performed a free search and we did not make use of any filters, these documents include numerous health areas, geographic areas, and content areas. So the items returned at the top of the list are going to be the documents most likely to feature the search term within the title or within the abstract. And these documents are most likely going to be the ones who carry the term as a central theme. So scrolling through, as we get farther down the list, we'll encounter more documents that either do not mention the search term within the title or documents that don't mention the search term within the abstract either. So the farther down that you get, the more likely you are to encounter documents that do not necessarily focus entirely within that search term. So it's often a really good idea to focus at the top portion of your search to get your search started. So if we look, for instance, at our second to last result here, oral artemisinin monotherapy removal from the private sector in Eastern Myanmar, if we click on this result, we will find that the abstract does not mention a total market approach like the title here. This result was returned at the bottom of the page again because it most likely mentions the phrase or a version of the phrase at some point throughout the article itself, but it's not really focused entirely on that concept. So as described earlier, we really advocate for using a combination of free search terms and the filter selections to return the most relevant results if you are searching within a specific topic area. So before we go back and tailor our search a little bit, let's take a look at the actual document listing. We really try to provide key information on this page for the user so they can assess the relevance of an article without needing to review the entire document first. At the top of the page under the title, you have your download file button. All documents in the Market Bookshelf do have a PDF attached. And beneath this, we provide the document abstract. If the document does not have an abstract, this section may contain the introduction, the first paragraph, or something similar. The last section here contains all of the file information. You may notice that these document tags are links. So clicking on the document title itself will bring you directly to the PDF of the document. So you can always click here instead of clicking the download file button at the top. The other tags will bring you to a list of all documents also listed under that tag. And this can be a really helpful feature. So say you were looking at this document on oral AMT in Myanmar and think, well, wow, this document is really relevant to my research. So how can I easily find more documents like it? Well, you can easily click on one of the authors and find all the documents written by them that are featured on the repository. So here we find 2 additional documents written by the author that could be potentially relevant to our search. So now let's return to the search page and perform a more tailored search. For this, we need the filter options and the free search. So you can directly access the window that contains the filters by clicking on the search button in the top right corner. So what if instead of looking for any type of TMA document, you were looking for one focused in family planning from sub-Saharan Africa? So now instead of returning 52 documents, I have a targeted set of 11 documents. And we can see scrolling through and getting to the bottom of the list that there's only one of these documents that does not explicitly reference TMA within the title. So now that we have demonstrated the benefits of using a combination of free search and document filters, I would like to go over some search tips that are unique to Market Bookshelf. First, before we continue, we should reset our previous search within the reset button. We want to do this because since the search engine has returned a set of documents for us, the drop-down filter menus are now populated only with the categories that are tagged within that search filter. So we can see here under organizations, for example, there's only a few organizations listed. But when I hit the reset button, this will now be fully populated, again, with all of the organizations listed on the site. So to gain access to all these category filters, you need to click the reset button to do that. So an important thing to keep in mind while searching through Market Bookshelf is that all free search terms will only return documents exactly as typed. This can be tricky when searching for terms or technology that might be referred to differently by various organizations. An example of this is DPO-SQ. So while the WHO terminology may be DPO-SQ, it is not guaranteed that all organizations we include documents from will use this terminology, or that some relevant documents may be older and contain outdated terminology. So a key tip is that if you are searching for a specific technology or term like this, and are not finding the results that you believe should be there, you may want to try searching for different variations of the name or a shortened version of the name to return more results. So if we search for just the term depot, we're going to return 15 documents. And now some of these documents may include Depo-Provera and not Depo-SQ, but we can see from the first result here, assessing demand for Depo-Sub-Q and Uniject, that had we just searched for Depo-SQ, we would not have returned this key document, and we really benefited from broadening that search a little bit. So I'll go up here and I'll reset the search bar again. And as Andrea mentioned before, we have tagged documents only in terms of the geographical region rather than the country of focus, and our tagging structure does follow the World Bank regional classifications. And like she mentioned, we have chosen this structure because many documents either do not have a specific country or their focus is on multiple different countries. So you can certainly use the search feature to find information on specific countries, and you might find the most closely relevant information by typing in your country name in the free search and selecting the appropriate regional classification. So for example, we can search for Kenya in the free search and then hit Africa Sub-Saharan and perform our search here. And then following this, we could choose to further refine our search to a specific health area or a specific content area, or we could explore the results here. But we want to remember that when utilizing free searches and reviewing the listed results, that you will never find a document with your search term in the title below a document that only mentions the term in the body of the document. So for example, here we see the last document listed here with Kenya in the title, and then below here it's just results from 9 countries, not specifically referencing Kenya. We know at this point in our search we're no longer going to find any documents below this that explicitly focus just on Kenya and reference that in the title. So this is a really helpful idea to use when you're searching through to kind of determine when you may have reached a point in your search that results may not be as relevant, and where to really focus your results and your exploration of documents. So these and related search tips are going to be added to the search page in a pop-up information box in the future so that the information is available for future users to access. So now we are going to briefly explore the other pages within the website, the About page and the Submissions page, and further explore the information that was presented within the presentation. So we can access the About page at any point up in the right-hand corner here. So the About page presents information on the purpose, scope, coverage, content areas, and filters of Market Bookshelf. And we also provide a brief FAQ on the side to anticipate and answer any questions that users may have while using the tool. This page is intended to address questions related to the overall purpose of Market Bookshelf and its goals moving forward, as well as to provide in-depth information on the content and tagging structure to facilitate use. So this page also tries to emphasize that Market Bookshelf does depend on user-submitted work to aid in the expansion of the website. So if we wanted to further explore the submissions page, we can click the submit button here and that'll link us directly to it. Or again, at any point we can access the submission page up in the top right-hand corner. So important item to note about the document submission form is that here at the file entry, you should enter either the URL of the document or add a file to upload the document with. The form will not let you submit if you provide both a URL and a document file. And please note that the URL should not link to a web page-based article. We are currently not including online-only sources. All documents should have a downloadable PDF or some other document form in order to be uploaded onto the site. So if I were to want to submit a document, I would use this form and enter my name here, not the author name, and my email address. This is so that if there's a problem or a question with the document, we're able to reach out to someone. Next, I would enter the type of document, keeping in mind the differences here. An analytical tool could most likely be a guide that perhaps encompasses forecasting or conducting any other type of analysis, or user guides, gray literature, referring to any resource that is most likely program reports and presentations, and other published literature really focusing on anything commercially published outside of a peer-reviewed journal, perhaps a book chapter or something similar. Next is the year of publication. If the year is not available for a document, you can always leave this blank. And for health focus area, you can click one or multiple areas, remembering that if the document does not focus on a specific health area, it can be classified as health area agnostic. And throughout this process, when it is submitted, an admin member from the Market Bookshelf team will review the document in order to make sure the tagging is correct and in line with the actual document. So if you're a little unsure on a category, that is still fine. Finally, you would add your URL or upload the document file here and provide any other additional information you may have. This can be the author or the organization, but this section is not necessarily necessary. Then you would just click the box below, indicate you're not a robot, and you can submit the document. And if you have any concerns or comments outside of document submissions, you can always email info@marketbookshelf.com directly, and someone from the team will respond as soon as possible. So this is the end of the demo portion of our presentation for Market Bookshelf. Thank you very much. And I will return to the presentation and hand it back to Andrea.
Great, Erica, thanks so much. Hopefully you all saw that this is fun and easy to use. And there are a few things that we are still updating slightly with some additional language, explanations on the filters, and so on. So that is, a few of those final changes are imminent. And at this point, really now is our call to action to you as we open this up for questions. So please feel free to be typing in any questions that you have at this moment. But what I'd like to really emphasize now is that our team is really looking to get your input in two different ways. First of all, to submit documents to us and to submit or suggest any sources that we should be looking for. So as Erica just laid out, you can basically submit any documents right now. And by the way, we of course have a method for avoiding duplication. So as we go through the uploading process, we have a super easy way just to determine that we don't already have the document there. And obviously you could also see from that source list, you could probably get a good feel for what we have already uploaded. And now you all know now the URL to go to, and we would certainly encourage you to do that, to start thinking about other documents, but also really importantly, to reach out to us with feedback on the design, the content, other things that you think that we might be able to tweak over the course of the next 2 or 3 months, just to optimize the website for everyone's use. And with that, I just want to finish with a thank you to a number of people, definitely a number of beta testers across various organizations who already ran some searches and gave us great feedback, which is resulting in some of the updates that we're making, as well as members of the Market Intelligence Workstream who really jumped in early on in discussions with Denise Harrison and others for how to approach this. And then of course, all the folks you see listed on the right. Denise, Julia, Eric, and I are super grateful to everyone's contributions to date, and as well as the things that we'll be doing going forward. So with that, let's take a look, Julia, for what questions we have.
Great, thanks, Andrea. So just a reminder that if you have a question that you'd like to do live now, you can raise your hand on the site, or you can type it in. While we wait for people to sort of type things in or raise their hand, there are a couple here that have already come in. So first from Jay Hebner, he had two about some of the filters. One was he said, from the perspective of supply chain, one might also be interested in the capacity of the private sector to provide services such as warehousing and distribution. This wouldn't be captured in any of the health areas. Consider adding supply chain as a category, question mark. And I'll read a second one and then hand it over to Andrea. So the second was he also said maybe consider adding emerging diseases, Zika, Ebola. So just in the second one, in terms of the emerging diseases, the health area does currently have other communicable as an area, so that would currently be where that would go. However, you know, it's always interesting to consider new options. So we will definitely see what else comes along and see if that makes sense. Andrea, did you want to tackle the one on supply chain?
Definitely. So I think Jay's question about supply chain is a really good one, and frankly, one that we can explore. I think the point about thinking about the capacity of the private sector, obviously we're doing that from a manufacturing standpoint with respect to commodities, because that's a core part of the kind of work that Unit Aid and others have done. So I think this is one that we can absolutely take on and talk about, because Julie and I have had a number of conversations about kind of the spectrum between supply chain and markets, and it's a bit of a gray zone. So to the extent we can make this broader and more useful to more people, all the better. So I appreciate that suggestion from Jay. And then I see our next question we have here from Animatu. Thank you for this one. I think we meant to address this during the talk, was any plan to have a French platform or at least resources in French which can be useful? So thanks for this question. The short answer is that is pending for the future. We did think about this. It was raised to us, and very rightfully so, and we definitely see value in expanding this. The challenge will be that we need to think about it from a technical standpoint, because it would impact the search function. So I would say that would be in, you know, version 2.0 that we would be thinking more about the feasibility of that. And
Thanks, Andrea.
Yeah, Denise or Julia, if you want to jump in on that.
Yeah, I was just going to say, Aminatu, it's definitely on our radar, and I think we would like to be able to be breaching that barrier that comes up sometimes with the language. And so certainly French and Spanish is something that we want to figure out how to do. So that will be on the radar for the next round. So are there other questions? You can also raise your hand and we can try unmuting. If people would like to ask a question in person or make a comment, that's also definitely a possibility.
And also, this is Andrea. I'll just make a call out to Denise Harrison. Denise, if you're able to unmute, if there's anything that you'd like to reflect on that we missed during the presentation, please feel free to comment at this point.
Hi, Andrea. This is Denise, and hi, everyone. No, I think you and Julia and Erica did a great job in presenting this. As far as supply chain goes, I think, as Julia said, we'll be on the lookout for how to work that in during kind of the next round of working on this. The only thing I would like to add is just to say that this did come from a work stream, the Market Intelligence Market Data Reports work stream, and do want to acknowledge those members, including Cindy Seisik, Renia, Aaron Seaver. I'm sure I'm forgetting some other people, but just acknowledge the workstream group that was there at the very beginning. But thank you both. Thank you all three of you guys, Julia, Andrea, and Erica. I think this was very good.
Great. So I also will just, before we wrap up here, in case, give people a minute or two more in case they have any thoughts they want to share. One thing I will say is that we've had some good discussions. We shared this with the TMA consultative group in April. And so we've had good discussions with people, and we know that one of the challenges with this type of resources, sort of its ongoing maintenance and actual submission of documents to keep it useful. And so that is one of the reasons Andrea mentioned we are kind of trying to explore more creative ways of getting documents, including given that certain donors are already requiring documents to be submitted, as Andrea mentioned, through the USAID DDL, for example. How can we simplify the process and get documents more proactively without having to get data dumps or document dumps from individuals who have a lot going on already? So we're hoping to find solutions there. And in terms of sources, if you have sources that we didn't mention that you think would be a rich wealth of documents, we're trying to just define the list of sources that we will regularly, once a month, go back to and be pulling from to make sure we're keeping the repository as up to date as possible. And so with that, unless Andrea or Erica or Denise, there's anything else you'd like to add, we can probably close. Anything you want to add?
No, I don't think so. Thanks again to everyone, and I would just encourage everyone to reach out to us with any follow-on comments. And we just put our contact info up on this screen there, but I think probably everyone would know how to find us anyway. So please just reach out with any additional thoughts, and thank you.
Great, thank you so much.
All right, have a great day, everyone.